All right, good day, everyone, and welcome to our session here today. I'm Tim Woods, one of the organizers, along with Becca Jablonski of this section here, and appreciate everybody joining us a little off the track of the main AAEA sessions. Hopefully everybody's had some chance to enjoy some of those meetings and navigate through all of the sort of ups and downs and bumps around all the technology issues. Do appreciate everybody tuning in here on a Friday in Kentucky afternoon. Our program titled Consumer Market Responses in the COVID Era, Implications from Observed Expenditures and Values, is co-sponsored with the Specialty Crops section in the extension sections of AAEA. And I really appreciate their support. And if you're not part of one of those sections, encourage you to reach out and see the good things and the good collaborators and things that those folks have going on. We're pleased today. It looks like we've got everybody on board here, ready for our slated for our presentations. And so we're going to have, just for the order of things, we're going to have Zhao Dong, who is going to be our moderator, keeping us all on track as speakers and move things through. And Zhao, will lean on you to kind of crack the whip on us, make sure we keep on task. We have Marilyn Sittiker that's joining us here that will provide some discussant comments there at the end. But we're very particularly looking forward to having a little bit of time that we buffered in to this session for some very open question, answer, response, feedback. Looking forward to your reactions on this. So without any further ado, Zhao, thank you so much for stepping in and helping moderate for us. Let me turn it over to you.
Thanks again, Tim, and I'm actually very happy to moderate. So just a brief introduction. I'm Zhao. I am a research economist at USDA ERS. I'm in the food markets branch of the food economics division. So I have a research interest in this area, so it's great I can kind of listen in and moderate the session. So I'm really excited to be here today. And I think the plan that Becca laid out was that we would have 15 to 20 minutes for each presentation. And then we would have our discussant, Marilyn, provide 10 to 15 minutes of discussion, and then we'll have a Q&A session. And I think everyone's okay with that plan, correct? Okay, so without any further ado, I guess we'll go ahead and start with that. Oh, sorry. And I'll keep track of time for the presentation. So I'll give you a warning when you have 5 minutes left, and then also 2 minutes left, if that's good with everyone. So without further ado, we can have our first presentation, which is changes in consumer meal preparation during COVID-19 and impact on food purchases. So.
Kristen,
Chris,
yeah,
we cannot hear you. You are muted. Sorry.
Okay. Well, I just lost a couple of minutes there. Okay. Our group at Cornell conducts a lot of executive education programs. And when we do this, we like to provide them a lot of action-oriented information for our group. So last spring in 2020, our group conducted a consumer survey where we asked consumers about changes in response to COVID in their online shopping habits, shopping behaviors, meal preparation, food purchases. So I'm going to present the information from the portion on meal preparation and food purchases. So at the time when we were considering our project, we were seeing panic buying. This was in early March. It was affecting inventories, retail supplies, empty shelves. We were hearing about the large companies, Google, Microsoft, Facebook, were sending employees home. And then we had and saw the shutdowns, food service closures, you know, in restaurants, schools, travel and entertainment. And what was happening specifically, this is a table listing our 5-state study region. And this lists the shutdown order dates. We see that they were all occurring within a few days of each other. What was also occurring is that, you know, some county areas were also instituting a state of emergency. So this is the shelves in the meat department of Wegmans on March 13th, which is when our county instituted a state of emergency. So Wegmans is a very lean operation. They don't have many suppliers in their categories. They are dominant in private label, and again, lean and just-in-time inventory. So it didn't take long for their shelves to empty in several categories, even when other retailers actually in town still had supplies. So it's interesting when we think and compare the state of retail shelves to supply chain strategies, and just as the disease impacted you know, people differently, it definitely has impacted retailers and manufacturers in different ways. At the same time, the data analyst Nielsen was pumping out national weekly retail sales information. This is the change in sales from 2019 by various retail departments in the weeks leading up to when we released our survey, which was May 21st. So just a little context about the changes that we're seeing here from Nielsen is that if you look at the line in green, which was the in-store bakery department, you can see that that was seeing sales, negative sales when you compared it to 2019. So, you know, our feeling was that this is in response because several retailers were severely limiting sales through in-store bakeries. Some of them had closed their in-store bakeries. And also there was probably a tendency of consumers not to shop that area because they were preferring to buy packaged products. And for instance, the Price Chopper locally, you know, had closed their self-service donut, self-service bagels, self-service bread operations, and were only serving packaged product. Again, our research objectives, and those that I will present specifically here, are those on field food preparation habits and food purchases. This table presents our respondent demographics compared to our 5-state study region, which was Connecticut, Massachusetts, New Jersey, New York, and Pennsylvania. We collected 780 responses between May 21st and May 26th via a Qualtrics panel. We think that we did pretty good in several demographic and were very representative, except we really fell short on race. And that is probably because we did not institute a quota in our responses. And this is one area that we were really disappointed in, and because we think it had the potential to influence the results. We also wanted to understand the impact of COVID on employment. So we asked the following question: what is the current economic situation in your household? And those responses in yellow were those that indicated a negative impact due to COVID on employment in that household. And 33.6% of our respondents had a negative impact on their work status due to COVID, which there was another, the Hartman group also asked it a similar question in one of their surveys, and they saw a 37% impact of COVID on consumer jobs. So here are some of our results. Our meal preparation question asked, how many times a week did you prepare breakfast, lunch, and dinner at home? How many times was it purchased or acquired away from home? We also had a skipped meal option, pre-COVID estimates, and during COVID at the time of the survey. So there was a 2 meal per week additionally prepared at home by our respondents, which was significant. And just a little way of envisioning the data that we got, if you look at the number of meals prepared at home, those respondents, 108 respondents, said that pre-COVID, they were preparing all of their meals at home a week. During COVID, the number of respondents who were preparing all of their meals at home per week doubled to about 227, which was about 39% of our total respondents. Just a little way of envisioning that data. Now, when I thought of an additional 2 meals a week prepared at home, initially I thought, well, it doesn't sound like an awful lot of change. But when you look at what that represents as far as food at home expenditures, it calculates to about $110 billion additional dollars spent at food at home expenditures if that lasted throughout a year. In actual terms, when ERS estimated food at home expenditures in 2020 above 2019, the increase in food at home expenditures were actually only 68 to 69 billion over 2019. So we know that this additional 2 meals prepared at home probably didn't last the entire year. This is just a look at food at home expenditures 2019 and 2020 estimated by the ERS Food Expenditure Series. So, who prepared more meals at home than others? When we look at our demographics, we see that the higher educated, female, and those 65 years and older tended to prepare more meals at home than others. But we thought it might be more interesting to find out who actually increased their meal preparation at home. So in this case, in this regression estimate, we used a logit model. We used a dummy variable for those who increased their meal preparation at home compared to those who did not increase their meal preparation at home. And we see the significant variables, again, are higher educated, higher income, 65 years and older, significant, but with a negative sign. Those who were unemployed and those who searched out information on COVID-19 daily. So those are the significant variables, demographic variables that we found for those who were increasing their meal preparation at home. We also wanted to understand how this change in meal preparation might have changed the foods purchased by consumers. So we asked consumers, have your purchases of the following increased, decreased, or stayed the same? And this table represents the net percent of respondents, the net who answered increase minus those who answered decrease. So we see a lot more shopping, a lot more people shopping in this shelf-stable foods and frozen ingredients. So our thinking is that these are categories indeed where people who would be preparing more meals at home could be shopping. They also tend to represent those categories where you would see stockpiling behavior, especially shelf-stable foods, food emergency buying, people in emergency situations often stockpile shelf-stable foods. So our tendency is probably thinking that those two different shopping behaviors were probably influencing that. If we look at heat and serve meals and prepared and ready-to-eat foods, there is the understanding that several retailers had shut down their salad bars and their prepared food in-store dining departments. So that also could have been influencing those decrease in those prepared ready-to-eat foods. How am I doing on time?
We have about 7 minutes left.
Great.
Well, about 6 minutes left.
Okay, thank you. So everybody's question back then was, how soon are people really going to return to former habits, former shopping habits, former food preparation habits? When we asked consumers this, there were, the majority, 61.8%, said that they would be extremely likely or somewhat likely to return to their food preparation habits post-COVID. That does mean that there was, approximately 39% of consumers who were neither likely nor unlikely to return to former shopping habits or former food preparation habits. So it does suggest that even though people like to think that they were going to return to former habits, that there probably has been a significant shift in attitudes towards returning to former habits. So we do want to acknowledge that. So in summary, the impacts that we saw were an additional 2 meals prepared per week at home. Those are described by those more likely to be preparing meals at home as to be higher educated female and 65 and older. Those who actually increased their meal preparation, higher educated, higher income, unemployed. Those who seek out information on the status of COVID-19, Those 65 and older did have a negative estimate. I wanted to note that females who were more likely to be preparing meals before actually had not increased their meal preparation. The estimated likelihood of returning to former meal preparation habits, 61.8% were extremely or somewhat likely. So to, our questions that we can, hopefully discuss here and with other people's insights were, what are the impacts of these just 2 more meals per week prepared at home, the impact on supplies and to retailers, and the impact to manufacturers were very, very large at that given moment. The impacts were perhaps not pure substitution from away from home purchases. There are some indications that it involved more panic buying and hoarding and emergency stockpiling than that pure substitution. And on the other hand, stores did shift their operations by eliminating salad bars, ready-to-eat dining, and bakery, in-store bakery categories. We felt that the impacts were varied, and this hasn't, from what we saw in the trade press, perishables seem to be performing okay. We didn't see a huge increase in consumer responses for increases in fruit and vegetable. Of course, meat was severely impacted, but perhaps not for reasons due to shoppers heavily shopping that department. So again, questions on what actually have been the impact. We felt suppliers were exceptionally responsive, but what are some of the more permanent impacts? Retailers have indicated that they would be streamlining their product assortment, as have manufacturers, but will they do that in the long run, or is this just a short-term, a short-run situation? What will be the impact of inventories on the supply chain? What will be the impact of any sort of shifts in geographic production and manufacturing? And of course, workforce and employment are huge issues. With that, I will end here, and after our presentations, we'll be ready to answer any questions that you might have.
Thank you. That was a very interesting presentation. So, I guess we're going to have our discussant now.
My understanding was that I'd wait until the end of all the presentations to do the discussion and kind of talk about them as a whole, so that I can kind of synthesize findings across all the studies.
Okay, that works that works too. So should we just move into the Q&A session now, or?
No, next presenter, I think that's what the intention was.
Oh, okay. Sorry. So next presentation.
Hello. I hope you all can hear me. I feel like I have not been Zoom presenting for a few months. My name is Hikaru Peterson. I'm in the Department of Applied Economics at the University of Minnesota, and I'm delighted to partake in a session with Lori Baker from University of Florida to share preliminary findings from our consumer survey that we recently fielded. It is part of the USDA-AFRI COVID-19 Rapid Response Project, which is carried out by an interdisciplinary team. And so Lori is in agricultural communication, Gustavo and Lee from University of California, Irvine. Their backgrounds are in geography and political science. So just briefly, what I'm planning on covering over the next 15 to 20 minutes is to provide you with a background on what we're trying to accomplish, go over just the methods and sampling, focus on the consumer survey, and then I'll ask Lori to cover the one of the two main areas that we're presenting today, which is the purchasing behaviors over 3 time periods. I'll cover the results from the choice experiment, and then we'll summarize the findings to date. And so I think it is helpful to provide an overview of our project because it explains the focus of our paper. And as I mentioned, this study is part of a USDA AFRI-funded COVID-19 grant, and it's addressing the priority area of economic security. And we're focusing on economic security of businesses in a supply chain whose livelihood depends on functioning supply chains, which of course the pandemic disrupted. Now, anecdotally, as Kristen was mentioning, when the first time you saw these empty supermarket shelves and whatnot, anecdotally, I think we've heard that the food industry turned to local and regional food supply chains, which seems to be a lot more flexible and nimble, and also that consumers are favoring like local or regional foods because perhaps they felt that they were safer, be handled, fewer times and whatnot. So this overall project is to explore the extent to which regional food systems can effectively augment mainstream supply chains. And we're using the term like local and regional interchangeably, as you know, it's a very ambiguous term. And we're really roughly trying to imply that these are supply chains or the part of the food systems that deal with foods that travel shorter, both in terms of physical distance, but in terms of number of transactions as well, compared to the mainstream supply chains. So in this context, we're focused on understanding consumer behavior through 2 study objectives. One is to examine the changes in food buying behavior during the pandemic, and the other one is to get some estimated change in demand elasticities under public health risks. Again, given the overall goal of the project and in examining the role of regional food systems to enhance the overall food system resilience, our focus points include the use of local food outlets, specifically farmers markets and food co-ops, and then demand for local foods, as well as this adoption of virtual grocery shopping, which perhaps some of us have gotten into. So I'm going to hand it over to Lori to cover the next part.
A little bit about our methods and sampling. It's been slower than we thought it might be. I think a lot of times this happens to all of us, but the survey is actually currently still in the field. So this morning we got a note that we were up to 957 responses. It's moving really slow. About 8 to 10 people a day are completing it right now. So it's painful to watch, but our general sampling frame is it's a non-probability opt-in sample. We're using Qualtrics, just like Kristen and her group did. We sampled for US residents 18 years or older, and then we stratified that sample by income, race, and region. The final sample will have 1,000 total responses. What we're essentially waiting on right now are some of those quotas related to race and related to income. So our lower income bracket has been harder to fill, as well as that diversity piece. And they keep asking us if we're sure, and we're like, yes, we will wait. So what we're looking at today is 849 responses. Because the quota is still unfilled, we do want to make sure and note that this may not be representative of some of the diversity that we're seeking and those lower economic distributions. The survey structure in general is looking at food purchases and acquisitions during 3 different time periods, and I'll give you a preview of those in a minute, followed by a choice experiment related to a public health crisis. Then on the next slide, these are the time frames, and we created some graphics for them to kind of remind our people what was happening in that moment in time. So what we'll refer to as time 1 is the early pandemic time there on the far left, which was March to April of 2020. And yes, they were limiting things. Shelves were empty, people were working from home, and schools were closed. And then we had this mid-pandemic time where we asked people questions about, which was August to September of 2020. And, people were starting to be okay to go to the grocery store, but they needed masks and social distancing came about. all those kind of things. And then current, which this graphic says June 2021, we actually switched to July and August since we kept pushing things a little bit further along. But people were graduating, they were able to see loved ones, they were getting vaccinated, that sort of thing. So those are the two timeframes that I'll refer to on this next slide. Oh, sorry, forgot that I was going to tell you first what we asked people to do was to compare prior to the pandemic changes in dollars spent by food category with this first time that I mentioned, this time one. So that's what we see on this graphic here is the change in dollars spent for food pre-pandemic to that time one period. So we essentially ask, did you spend less, the same, more, or did you not buy for some of these categories? And anecdotally, I was surprised at how many people did not purchase alcohol during this time. I feel like that was a thing we were hearing, that alcohol increases were just happening all over, and perhaps they were in my household, but it does not look like that was the case for the majority of people. As Hikaru mentioned, we were really interested in the kind of fresh fruits and vegetables and local food pieces. As you look at those, the majority of the people were spending the same in those categories. There were some people who were spending a little bit more. By large, there were less people spending less in all of these categories, which I think we found a little bit surprising. But again, we also have to remember that we don't have as many of the lower income households in this current sample. The next time period that we asked about was we asked them to compare that time one with time two, so that early pandemic to that mid pandemic, to again ask those same questions of whether they spent less, the same, more, or didn't buy in these categories. And again, we were kind of thinking, well, these comfort food areas might go up, and they did some. If you look at the snack foods and the chocolate and confectionery, there were people that were buying more of those items. They were stocking their pantries more with the pantries and dry goods. But fresh fruits and vegetables, by and large, remained the same for the majority of people, again, during these time periods. And again, many of those categories didn't change. So then we asked people to compare that third time period. So what did they do mid-pandemic to their current situation? And we started to see a similar pattern here. People were maybe buying more fresh fruits and vegetables, which was kind of exciting for our purposes. They were still increasing in some of these categories related to those comfort foods like snack foods, as well as some related to frozen desserts or coffee and tea that they were consuming at home. But again, very similar to our other time periods, the majority of the people were purchasing about the same in all of these categories. So after they completed that, we asked them about the logistics. So how did they acquire the food from all of these different category areas? And so you'll notice in these graphics, you'll have a time for, and essentially this time we asked them not only for what they were doing in all three of these original time periods, but what they thought they would do in the year 2020, which sounded really far away, but it's not. So we asked these for all of the categories. There's something like 10 or 11, but I'm going to highlight 3 of them to make it a little simpler on what we can manage today. But for supermarkets, you can see that across all of the time periods, people were still purchasing in the store or to eat in for the majority of people, which I think was surprising to us. As we looked at our personal behaviors, we felt like this did not reflect them. So again, that's great that we asked these questions. You do notice in time 3 and time 4, more people either were going back to the stores or were considering going back in the future. But we certainly did see that people along the way in time 2 were increased related to some of that home delivery, related to curbside pickup, but just not as much as we thought we might see in these categories. The same was true for farmers markets. I feel like for me, one of the most interesting things was that farmers markets were offering all of these curbside options, phone ordering, online ordering. We haven't, of course, broken down regional differences. So it's possible not all farmers markets were open or offering these things, but there were people that were acquiring food from curbside, from home delivery, and from pickup during these times. And interestingly, that in-store was actually much less here in the numbers. Of course, we have a high numbers of non-users. Hikaru and I kind of discussed that, and we thought, well, we just thought this was really picking up. And I think it is still possibly picking up. If you think about it, close to 40% of people were using farmers markets, which perhaps that's as much as we can expect for people to do related to regional and local foods. So we also included the local independent restaurant in this presentation because this is another thing that we thought was happening a lot. And it was happening some. It does look like in time 3, people really were headed back to their local restaurants in person. And by 2022, 50% of them plan to be back in those regularly. But we were pretty surprised by how many were in the not used category, since there was so much marketing related to supporting these local businesses during these times. But again, same with farmers markets, those local businesses appear to have been able to be pretty tech savvy in getting curbside delivery and online ordering for people, at least in the whole sample right now.
Great, thanks, Lori. So to parallel like what their experiences were, a choice experiment was designed to estimate the impact of public health risks on consumer behavior. And we asked the respondents to make grocery shopping choices under 3 situations. And, you know, I'm sorry for the confusion. There are 3 time periods. We thought about mirroring it, but we thought that, you know, during our lived experiences, the risk and ambiguity about the pandemic was just too confounded. And so we thought that we'll use the risk levels that were established by the New York Times, along with Johns Hopkins experts and so forth. And you may already have like a trauma from looking at this county level data, but we're basically looking at 3 situations: 1 where the life is normal with no major health risks; 1 with the extreme high risk where their guidance is to choose delivery or curbside pickup instead of shopping in person; and then the very high risk situation where you can lower your risk while grocery shopping by keeping your visit as short as possible, but use curbside and pickup where possible. The scenario for consumers was that they were ready to buy their regular assortment of food groceries from a retail outlet 3 miles away. Regardless of the value of the purchase, there was a fixed delivery fee. And besides the value of the groceries, the attributes that we included were the logistics. So whether it was in-store purchases compared to the virtual options like curbside pickup and at-home delivery, and then the outlet, farmers market, food co-op, or supermarket, and then the origin, whether they're local or not. The choice task code presented for 2 options for the respondents to choose from, or a 3rd option to opt out. And every respondent was asked to make 2 choices in each of the 3 situations for a total of 6. The responses were analyzed using a random parameter logit model where coefficients on grocery shopping attributes are specified as normally distributed. So you see the mean parameters and the standard deviation parameters. And the mean parameters are specified as functions of public health risk levels. And so here, again, these results are based on the sample as we had as of last week, so 849 respondents. You do see, I think, even though this was like generated, you know, under time pressure and whatnot, I think it's fairly reasonable to see that, you know, that people don't like high values of grocery stores, and then people prefer to buy, so the opt-out has a negative coefficient and so forth. So if you look at the top part of the panel there, in normal times without public health concerns, people on average prefer in-store purchases, but yes, it's good, it's confirming, over curbside pickup and at-home delivery. The coefficient seems to be a lot less, but people prefer supermarkets over farmers market and food co-ops. And on average, there's no difference in terms of preferences for local foods. But if you look at the standard deviation parameters, they're all statistically significant, suggesting that these preferences are indeed very, very heterogeneous across people. These are the shifts in mean parameters under the high and medium public health risks. And what really comes out right away is that relative to normal times, preferences for curbside pickup and at-home delivery are very sensitive to the public health concerns, but not necessarily for the outlets or the local foods. And again, these are averages. And we can get a little bit more insight into looking at the distribution of individual willingness to pay for these grocery attributes. And so these are cumulative distributions of those individual estimates for various grocery attributes relative to the base attributes. And so I plotted it in a way so that we can look at it essentially as like a demand curve. So on the horizontal axis, measuring the percentage of population, and then the vertical axis is measuring the dollar premium or discount, again, relative to the base attributes, shopping in store, in supermarkets. And looking at where these lines cross the x-axis, you can get a little bit of an insight here. So if you look at the orange line, for example, you see that little less than half of the people are willing to pay for grocery delivery services under normal life. And then if you look at the darker blue line, more than half were willing to pay for local foods, which kind of matches up with the half aspect here. So another thing that comes out is that the demand curves for logistics are a lot steeper than the outlet choices, which is what we kind of expect, I think. So these are the estimated changes to the demand for logistics. And so you can see that the blue shades are representing like the curbside under the different situations of public health risks. The warmer shades are representing the curbside delivery. And again, it might be a little bit hard to see, but without the public health concerns, you can see that about 40% of people were willing to pay for curbside pickup. But then under the high risk, the highest risk, you see that it has increased to about 80% of the population. And the impact is less for the delivery, where slightly less than 50% were under the normal situation, but increases to about 65% under the high risk. In what also comes out kind of here intuitively is that the demand for delivery seems to be more price inelastic than the demand for curbside pickup. So people seem to have more of a fixed preferences for delivery services than the curbside pickup. Thanks, Xiao. And just quickly, we have similar graphs for demand for outlets, which isn't as interesting, but the only interesting thing is that the shift, unlike the demand for logistics, is not linear. And so, for example, the demand for farmers markets over supermarkets declines initially with the increase in public health risks, but then it bounces back as the public risk heightens. And we kind of see this nonlinear shift in relations to public health risk in the demand for local foods as well. So it actually increased initially at the medium risk, but then it declined as the public health risk heightens. And we kind of assume that there's some sort of a priority going on in the consumer's head about what really matters, in weighing the public health risk with other things. So just quickly summarizing the findings to date, the food purchases by category remained largely consistent for majority of Americans, with the caveat that we do not have the lowest income and the least vulnerable population in our sample quite yet. But the way Americans acquired food shifted throughout the 3 time periods. In particular, the demand for purchase logistics seems to be drastically affected by the public health concerns. And then the changes in demand for local outlets and local foods, which have been our primary interest during the pandemic, seems to be really sensitive to the level of public health risks as well. So with that, I will stop sharing my slides.
Thank you, Cora and Lori. That was a very interesting presentation. So next we have consumer expenditure change across U.S. food market channels during COVID disruptions, implications for produce markets.
Okay, so My name is Haley Edmondson. I'm a master's student at Colorado State University, presenting some work that we'll actually hear from a couple other folks on this same project, but some findings from a nationwide consumer survey we did related to COVID, and this is work that Dr. Becca Jablonski and Don Thelmany and I've been working on. Okay, so I think we've heard a lot about this given the theme of the presentation so far, but I'll just speak a little bit to it since this is really some of the motivation for why we were doing the survey to begin with. But obviously there were a lot of consumer trends during COVID related to increased use of online platforms for shopping, increased food at home spending, changes in shopping behavior, so how often and where folks are going to get their food items. And the one that we're particularly interested in is perhaps this increased interest in local and regional food market channels. So we've heard a lot from farmers markets and farmers and CSA managers that they saw huge growth in sales at the beginning of COVID, and we're interested in why this is happening and to what extent it actually is happening. So, and again, just to motivate this a little bit further, this is from a New York Times article last September titled 7 Ways the Pandemic Has Changed How We Shop for Food, and it's noting the increased interest in local food. The fragility of the supply chain, concerns over health and safety, and an appreciation of community have buoyed the movement toward food that is raised or produced locally. So in response to that, this work is part of a larger project funded by the USDA Agricultural Marketing Service called Local Food Systems Response to COVID. So we, as this project, saw that there were these impacts, especially unique impacts to local and regional food markets and food systems. So there were 16 partners from across the food system, everybody from farmers markets to local fish and seafood. You can see that there's a lot of different partners at the bottom, but essentially convening these people to discuss what the impacts have been, and then continue on with some research efforts to dig a little bit more into what's happening on the supply chain side, how are the responses of these organizations affecting their communities of practice, but also from the consumer side. We've been seeing these increased interest in local food, and how can we maybe extend that to inform some of these partner strategies moving forward. So I guess a little bit of the survey overview. Actually, wondering if I can just go to this. So we did a nationwide consumer survey in the fall of 2020, and we surveyed 5,000 households. This was, again, this was a Qualtrics panel. We actually enforced a couple different demographic quotas here, including income, race and ethnicity, and age. We didn't include a quota for gender because we were asking about primary grocery shoppers in the household. And we know that sometimes that's still primarily women, so we didn't actually enforce a quota there. But this is just kind of a breakdown of that. Similar to another, I think the previous presenter actually also talked about different time reference points. So we also asked about 3 different time reference points in our survey, and this was related to, in contrast to some of the other presenters, we actually were asking about a set of really disaggregated market channels. So as opposed to asking about products, we're really interested in where people were shopping and getting a little bit more specific than a lot of other surveys have gotten in terms of these market channels that people are using. So we used September 2019 as the pre-COVID kind of benchmark. We also use that. We have some existing data that we can kind of benchmark against. We used April 2020 as the onset of COVID behavior. So obviously, when a lot of those initial shocks were happening, shortages and things like that, stockpiling behavior. And actually this graph at the right shows that peak or that little spike in total food spending at home is actually kind of peaking in April during some of those shutdowns. So we felt like that was an important inflection point to capture. And then September 2020, we administered the survey in October. September it made sense as kind of representing the most immediate past current behavior that was happening the month before. So, well, I'll go quickly back a couple slides, but essentially I mentioned we asked a lot about disaggregated market channels, where consumers were shopping in those 3 time periods, how much they were spending, whether or not they were shopping online in those market channels. And we also asked several questions about food values and kind of consumer confidence questions related to the use of local market channels. And I'll talk about that a little bit more later, as well as COVID questions related to exposure, change in employment and income, and demographics that we captured. So I'll talk a little bit about the expenditure findings that we see. And again, the reason why we included a lot of these disaggregated market channels is because we're really interested in how the behavior in some of the more traditional market channels like large format grocery stores are different from the more specialty or alternative channels, those local and regional market channels, direct channels, things like that. So this is kind of a graph of food expenditures by channel in September 2020. And we see that's still a large, over half of, on average, the consumers' responses were that their budget share is going to large format grocery stores. However, we actually do see, we see a significant share still going to these other smaller and more specialty channels like small format grocery stores, artisan and gourmet stores like bakeries and butcher shops, health food stores and things like that, which fall in these limited selection and independent and specialty stores. So while it's a small portion of the total spending, I guess, it still is representing, if we kind of multiply that out across all these different consumers and perhaps looking at the changes across time, there is still quite a bit going to these other smaller channels. So again, because we asked about these 3 different time periods, we can get a better picture of perhaps which of these channels that we asked about, and here we can see all the different channels that we included in our survey, what those changes looked like across time in terms of those weekly food expenditure shares in each of these market channels. So obviously, I mean, we can see at the far left of this chart, we see these more traditional supermarket supercenters seeing some increases there in terms of expenditure shares. And I think partially that's due to, we also overall saw that people were using less market channels than they used to be. So if you're dividing your spending between less channels, it's going to perhaps kind of affect that. And supercenters and supermarkets having, providing maybe an opportunity for people to purchase more at one place and make less trips. But the interesting thing we see also is that small format and independent grocery stores, as well as artisan and gourmet stores, actually do see an increase in food expenditure shares from last September to this September, or September 2020 rather. And there could be, I mean, this is something for us to further investigate, but perhaps greater perceived safety at smaller channels where there's less space and perhaps less chance for interaction and contact. And even some of these smaller stores having an easier time pivoting maybe to some of the curbside and online things that consumers were increasingly participating in. So something else that we were hearing a lot is that some of these local and regional market channels, we're seeing a lot of new business from new customers. So that's one thing that we definitely wanted to capture in our survey is how many of these consumers are purchasing or are new customers at some of these local market channels. So we asked people in our survey if they shopped at a new outlet in any of the following channels, and we specifically focused on these local and regional channels. And about over a third of our sample actually participated in or shopped at one new to them local or regional business, and actually 17% shopped at more than one new business to them. And so I think I mentioned a little bit earlier, you know, it seems like it's not the majority, obviously, of the sample, but if we kind of multiply that out, it does represent a large number of households using new markets. And, you know, I think a next step for us too is thinking about how these new customers persist, and that's an opportunity for these smaller market channels. So we also wanted to capture perhaps what's driving some of these changes in behavior. And we focused a little bit on values and what we're calling perceived consumer effectiveness. In other words, how somebody perceives their impact on their environment. So, you know, do they really believe that their food purchasing has an impact on the local economy or on the business that they're purchasing from? So we're going to focus on a few here, and this just shows these blue bars show the strength of agreement or importance of the following statements here. And we're going to focus on the consumers who valued supporting the business that they're buying from, that the product they're buying is locally grown, and that if they believe that local food products are easily available to them. So how are some of these values driving purchasing at different channels across these groups that are agreeing at different levels with these values and confidence statements? So we see, I guess, these different groups here, the locally grown and the easily available local food and supporting local businesses are all basically those who strongly agreed or agreed to the statements that I showed on the previous slide. So we do see that they are spending, and this is a expenditure share at these different local channels in these different groups that have different levels of values. And so we do see that, especially, and we can focus a little bit on these niche and independent specialty stores that I mentioned earlier, seeing some changes during COVID, as well as the direct markets piece, which we were interested in as well, seeing those values represented in their expenditure share. So those who highly value locally grown, highly value supporting the business they're purchasing from, we see a greater, I guess, expenditures at some of these more specialty channels, reflecting it in their values. So something else we were interested in is, I guess, not necessarily just focusing on expenditures, but market channel participation generally, and this is again focused on that locally grown piece, we see the difference between the blue bars are those who highly value locally grown, and the gray bars are neutral. And this is the rate of participation at these different channels. So across the farmers market, food box, direct from producers, all the way to the small format and artisan markets, we do see that those who value locally grown are participating at a higher rate in September 2020. Something that's interesting, and I think a couple other presenters have mentioned, is the difference between the large national and chain restaurants versus the independent and local restaurants. And what's interesting here is we don't see a huge difference between those two groups, and we did ask separately about them. And I think the interesting takeaway here in terms of from a marketing perspective is that these local independent restaurants don't appear to be benefiting at the same level from that kind of like local premium, I suppose, as some of these other markets in terms of valuing something that's locally grown. It's not really translating to some of those local independent restaurant channels. So that's something that we thought was interesting. So I guess to conclude, and I think this survey was very rich, so we have a lot of information still to sift through, and a lot of questions can be asked about this. So this was really an overview of some of the findings that we're beginning to see. But one of the interesting trends that we saw across a couple of our analyses is this increased participation in specialty and local market channels, particularly in some of those artisan and specialty markets and small format stores. And we also see consumers shopping at these new channels that represent a combination, I think, of customers that are new to those channels, as well as customers who are increasingly using some of these local and regional market channels. We find that values are one component that may be driving some of these changes in market channel participation. And I think some of our next steps are thinking a little bit about persistence and how we can capture persistence from our survey to inform, marketing strategies for the future, because I think that's one of the main goals of the partners we were working with when we developed this survey.
Great, thank you, Haley. That was very interesting. I like looking at these smaller channels. That was very interesting. So next, we have COVID era regional consumer food values and local food supply chains.
Just make sure hi, I'm Jairus Rossi. Are you seeing the PowerPoint?
Yes.
Yep.
Good deal. I can't really tell from my perspective. Anyway, I'm Jairus Rossi. I'm at University of Kentucky, and I am presenting on behalf of Tim Woods and Azita Varziri, my colleagues here in the Department of Ag Economics. And so, this goes along pretty well with what's already been said so far. So it's pretty wonderful how this has all come together in an interesting way. So as discussed already, we all saw disruptions across the supply chain starting in the spring of 2020. Processing facilities struggled with maintaining a healthy labor force in some cases. Consumers started panic buying, and retail operations could not keep certain items on the shelf. So consequently, many people started to become more creative with how they acquired food. In particular, local and regional farm businesses, whether that's farm markets, CSAs, farm stores, local distributors, produce auctions, etc. All of these different venues provided options for purchasing food. In some of these cases, they had the added benefit of being socially distanceable for those who didn't feel safe going to a crowded grocery store. And at the same time, though, as Kristen and Haley both noted, other consumers were increasing the size of their purchases at traditional retail outlets while taking advantage of things like curbside delivery and online ordering platforms. So these different strategies and behaviors highlight the obvious, that consumer motivations and values while buying food are diverse. Some folks are more price sensitive, and some people want more convenience. Other people really want to support the local economy or underrepresented producers. So during COVID, many are understandably more concerned about safety and public health. So our main focus in what we're trying to do here is understanding the relative importance of different consumer values related to food purchasing during the pandemic and beyond. And so this builds off some of the questions that Haley was looking at in the previous presentation. And that's because it's from the same survey. We are all part of the same collaborative agreement with AMS to look at local and regional food system response to COVID. And so we were given the opportunity to interpret some of the data and work with CSU on their national consumer survey. And it was very wide ranging, as Haley described, and attempted to capture some consumer perceptions and behaviors from the first 6 months of the pandemic in the US. So this presentation will focus on two specific survey questions related to what consumers value in food purchasing, as well as general attitudes about COVID and how it affected their purchasing. We're mostly interested in the geographic differences in food values rather than evaluating specific consumer segments. So we take this approach because, as you probably noticed, COVID-related public health and mitigation policies were rather uneven in their implementation across the US. Additionally, COVID was more intense in different places at different times. And so, one example is that during the time that we put the survey out, rural counties really hadn't yet experienced the extremely high COVID incidence rates that were common across all of last winter. So because of these differences in experience, we expect that there might have been different values and attitudes towards food purchasing in COVID more generally, depending on where someone is located, both in terms of geographic region, as well as the size of the community's population. Okay, so we like I said before, we focused on two very specific questions, both scored on a 1 to 7 scale. The first question was about values. People were asked to rate how important certain factors are to their food purchasing decisions. And the second set of questions asked respondents to agree or disagree with certain statements. Some statements were related to values important in food purchasing, while others were specifically related to the perception and experience of COVID. For the analysis, it's pretty simple. We used a Tukey post hoc test following ANOVA to compare mean scores for each question. Once we segmented all of the respondents into 2 different sets of groups based on different criteria. So Tukey tests indicate whether mean differences between groups are significantly different. In the first set of groups that we created were based on the population of the respondents' community. And we used the rural-urban continuum codes, the RUC codes, to make these groups. So the 3 groups were the larger metro regions, which were counties with metropolitan populations equal or greater than 1 million. Mid-sized cities are counties in metro areas with less than 1 million people, and all other counties were classified as non-metro. And you can see the specific RUC values we used below to create these different groups. And then the second set of groups we were created using regions developed by the Sustainable Ag and Research and Education Organization, the SARE organization. And for the sake of visual representation, here's a shabby map that I made of all of the respondents coded by the size of their community. So each dot represents one of the 5,000 total responses we had to this survey. Red is your large metropolitan region. Blue is your mid-sized city, and yellow corresponds to non-metro counties. And as you can see, many of the responses were found in large metro regions, and there are fewer responses from the middle of the country. But the survey responses, I think as Haley mentioned, were largely representative of population distribution and in the US, as well as in terms of demographics. We had a pretty representative sample. So, and then here is my a map that from SARE that shows how they delineate regions. If a response was within that region, they were coded as being part of that. And for the North Central region, I'm calling that the Midwest, so it's easier to interpret. Okay, So here's the results for now in this first results slide, we're just evaluating what attributes consumers consider when purchasing food. And we're organizing the mean responses to these questions from high to low. And at this point, it's important to note that we have not yet segmented the responses by region or community size. That will come in 2 slides from now. And so not surprisingly, affordable food is extremely important to people generally. And consumers value a safe shopping experience where workers are also treated safely. So in other words, during and probably beyond the pandemic, most individuals want a food purchasing experience with little risk. You know, and then the next most important thing was people are placing value on food that is perceived as healthy. So those are the first 4 in order of, you know, magnitude of the means. But then the next 3 values are interesting because they're related to social and economic impacts of purchasing, such as supporting a local business and supporting the local economy, which may in part have to do with knowing and trusting the providers of these food. So social and economic relationships are important here, or an important aspect of purchasing, but maybe slightly less so than health, safety, and affordability. Surprisingly though, convenience, such as having an option on your purchasing method, is a little bit less important. One might think this should be higher given, you know, the explosion of online ordering and curbside options, but as Lori noted, not as many people may be using these markets as we think are using these markets or these options. Other social attributes such as food meeting cultural preferences are less valued by the whole respondent population. And then finally, foods being local or organic are less important overall than all other attributes. But as you can see, I mean, everything here is rated above a 4, which is sort of the line between important and not important. And when you look at sort of the breakdown of just percentages of who answered what, it paints a similar picture. So all of these people say all of these things are important. They're just different relatively. Okay. So then the second slide, second results slide, we show the means of values questions related to marketplace behavior and the impact of COVID on food purchasing. Respondents overwhelmingly agreed that reducing the spread of COVID is important. They also agreed with statements about sacrificing certain modes of food consumption in consideration of public health. This might be something like reducing the number of visits to stores, going less frequently to restaurants. Now, some of this was enforced by, you know, lockdowns or restrictions on dining capacity. And so while, you know, people generally agreed that COVID restrictions impacted how and where they could find or could buy food, they agreed to a lesser extent that COVID impacted their ability to access healthy foods. So now moving on from COVID specific questions, respondents agreed that their general purchasing decisions can have a positive impact on personal health, local economies, and society in general. But they agree to a lesser extent that local food is easy to find or easily available. So in short, the whole respondent population agreed with or placed importance on food purchasing behaviors that are related to positive impacts on health, safety, economy, and society. So it would make sense though, that with different consumer segments, once identified, they might have different, more heterogeneity in what they value. So to that end, we break these same questions down by community size and region to see whether and to what extent these values differ. Okay, so again, just as a reminder, we use 2 key tests to compare group means. For the community sizes, I indicate statistically significant differences between means using superscripts of different letters. So if there are no superscripts, that means that the means are not different. If there are 2 or more superscripts, the ones with different letters indicate significantly different means between those groups. For just the sake of readability, with the regional differences, I just described that in text form because otherwise it got to be a bit of a mess. In general, so for these results here, the large metropolitan regions showed the most difference from other community sizes. These differences can be seen in higher scores related to workers being treated safely, food having health benefits, having increased purchase options, meeting traditional cultural preferences, and purchases supporting historically underrepresented groups, and food being organic. So in short, residents in these larger metropolitan areas are placing more importance on social and environmental impacts and attributes of their purchases. On the other hand, residents, regardless of community size, equally value, when comparing groups, safety and shopping experience, supporting local economies and relationships, and whether or not a food is local. So moving on to regional differences, you can see really, this is still ordered somewhat in terms of high to low score, but there are not many regional differences in the attributes that people value the most. But there are some regional differences, such as the southern region showing increased importance of having options about purchasing methods. Southern respondents also are placing more importance than those from the Midwest on food having health benefits and meeting cultural preferences. And the Midwest has lower relative scores related to foods being local or organic. I don't have any good explanations for these, so if people have ideas that would be interesting to get to in the question and answer session. And then our final results slide shows a few differences in consumer values again. Larger metro areas agree to a greater extent with statements compared to other community sizes on a few questions. These residents more often agree with statements related to making food consumption sacrifices for public health concerns and perceiving COVID to be more disruptive to buying healthy foods. They also scored similarly to mid-sized cities and higher than smaller communities on questions related to reducing the spread of COVID being important, purchasing foods that positively impact health, affecting positive social change, and finding local foods to be readily accessible. All community sizes agree equally with the statement about purchases impacting the local economy. And again, the regional differences, there are not many, and for the attributes that are rated with the highest importance or the most agreement, there aren't really regional differences, but Midwestern respondents agreed to a lesser extent about COVID impacting food purchasing, as well as finding local food to be accessible. So there's just a few differences. Okay, so why is this important? To some degree, it shows that geography and community size matters. The last set of questions shows that respondents from smaller communities in particular were less concerned about mitigating the spread of COVID, which might be explained in part by how the pandemic progressed. I mean, as I said before, this survey was given out before smaller communities were hit very hard by, with the higher incidence rates. But in relative terms, this question was still scored highest among all of the questions for the smaller communities. So this is very important to smaller communities, just slightly less so than when you're comparing to this other community sizes. Additionally, local food isn't perceived as accessible in smaller communities, maybe because producers and distributors are favoring larger markets. Maybe there isn't the distribution infrastructure in place to get to grocery stores, or maybe because the term local food just has a completely different meaning or not as much resonance. Residents from large metropolitan regions placed comparatively more importance on social impacts of food purchasing. They perceived COVID as more disruptive and valued more options for food acquisition, potentially because of these disruptions. And again, because those were the places hit hardest when we gave this survey. So it's worth wondering here whether these differences are explained by inherent difference in place, things like urban versus rural perception, or if there's a differential progression in experience of COVID impacted how people perceived and answered these questions. So, a follow-up national survey would probably show some changes and patterns in how these values shift over time, given a different kind of experience with COVID and with food systems. It's also worth considering where consumers generally share values. Everybody wants safe, affordable purchasing experiences, and they state that they want to support local economies. So maybe a focus here would be on better communicating how local and regional food systems are tied to local economies, especially as a way of maybe improving food system resilience more generally. So maybe that would be a practical outcome from some of this work and our experience of COVID in general. So following this, local food stakeholders might continue to find ways of making local and regional food more accessible and price competitive. I know that's a challenge, and successful strategies here are always going to be specific to place and to specific consumer segments. So where we go from here is, we're going to continue to analyze the data we've received. We've had so much data from this project, but we also need some more new data. A fruitful avenue might be to segment respondents using these values questions, somewhat similarly to how Haley was talking about it at the end of her presentation. We can see how other behaviors captured in the survey, such as those related to expenditure changes in specific market venues, are related to people identifying or being in different consumer segments as identified by how they answer these values questions. So this segmentation analysis might also help explain some of these regional and community-sized differences. So we're really just at the start of this analysis, and unfortunately, COVID keeps shifting our various behavioral landscapes. So, all we can really do is pay attention to how consumers and stakeholders are interacting with their food systems and adapting to every new challenge. Thank you for your time.
Thank you for that. Can everyone hear me okay, or is my audio still?
Are you able to see things, Zhao? At least you can hear me okay?
You're good,
All right,
Tim.
perfect. All right, good. Yeah, so a last presentation then before we toss it over to Marilyn for some discussant time, and then open it up for some general conversation back and forth. I wanted to just share some ideas about working with this consumer information and translating it into our extension spaces, some of the work we do in our land grant university spaces, with working with consumer groups, with farmer groups, but also with many different kinds of agency and partners, including USDA and others that have all been in here wrestling with these kinds of challenges, and especially focusing on responding to data. And it's really the proverbial drink from a fire hose. There's so many different metaphors that we can use in terms of the kind of information that was coming out, needing to be processed. And I think a really critical role and opportunity for economists to be in the middle of these conversations, as we've just seen so much change and disruption, and working toward helping to translate data, identify new and more responsive data sources is part of an ongoing conversation that we're having. And as Haley and Jairus have already mentioned, this local food systems response to COVID project that we have involving these different partners. What we were seeing in this project were lots of different local food systems entities or channels in the various marketplaces, all seeing lots of different kinds of disruption, measures of disruption, and trying to understand the response of consumer choices echoing back through various parts of the supply chain, and the implications for not just farms, but for all the different partners along these different local food system distribution channels. And as this project managed and organized in collaboration with the Ag Marketing Service folks, has led to some very rich conversation, really good opportunity to try to process these data, think about these consumer changes in behavior and activities, and the implications that they have for these different market segments. One of the things that we did in convening everybody was just having some listening sessions and just kind of hearing from the different partners involved in these local food systems, communities of practice, just their perception. It's just an exhausting time, as you can imagine, for a lot of these entities that have been working themselves with trying to organize nationally conversations, understand data, respond to changes, very sudden policy changes that were widely variable state to state, urban, rural, lots of new food access questions. And everybody, all of us here, I'm sure, were involved scrambling, trying to process the information that was coming at us. And certainly a very unique environment and a unique disruption in terms of impact on consumer food choices. We've seen already described in a lot of the studies that have been done. But thinking about the market channel disruption and the changes that took place pretty much everywhere in the farm to pretty much everywhere, from the supply side response, farmers trying to have and create innovative ways to develop capacity to adapt. But something that is really characteristic of these local and regional food systems, parts of the marketplace, is that I call them kind of gray markets, where there's just relatively little data. What data we have comes through in a trickle or is not very representative, and there's a lot of sort of jerry-rigging, do-it-yourself, baling wire and Band-Aid, cobbling together data activity. One of the things that we were seeing in these conversations from the communities of practice were, in some quarters, big surges in demand: agritourism, the on-farm retail, CSA. Some farmers markets were just going great guns with lots of new activity, and some of them were shut down. Big increases in local meat processing, and certainly in the grocery sector initially, there was a lot of pivoting from the food away from home channels, as we've kind of looked at here before, to sourcing from groceries and looking at different ways to manage that. Other segments really saw, what I'm seeing here, the crowbar and the spokes. Things just came to a grinding halt with farm to school, farm to restaurant programs. In farmers markets, if you were a vendor with non-essential products, you were essentially, in many cases, put on the shelf. And in 2020 anyway, very limited opportunities to participate. And so where I'm trying to just take us here with a few points to consider as we think about certainly in extension. I've got a majority extension appointment, and so I'm always thinking about how do we look at these data or use these data or even work with entities to help us identify data that we need to help folks make better decisions in a very volatile marketplace. And one of the things I think is critical for all of us to we were facing an immediate need to better understand the variable consumer response and the kind of impacts of COVID on income, on race, and as Jairus and Azita just talked about, even on geography, the urban-rural issues. I think there's through this data to better understand these changes in values and behaviors, as we've talked about here already. But while we need to understand the consumer impacts, there are implications for understanding these consumer changes in behavior and changes in demand to the market channel implications for producers. And in terms of the data, part of it is data is a funny thing. There's the quantitative data, but there's also the storytelling qualitative data that is very rich out there. And what we saw with our communities of practice, they really wanted to know more about what are the innovations that are taking place in other parts of the country? How are other communities adapting to these sudden changes? And how do we gather that kind of storytelling qualitative data into the conversation? As in the local food system space, this retention question is a very important one for a lot of our farms, as a lot of those CSAs, agritourism, and other entities, local fisheries, saw a big expansion in consumer interest and participation. even the food consumer co-ops. A lot of them right now are asking these questions about how do we retain those folks that made new visits to these markets. And then even in this kind of bigger picture beyond this sort of immediate kind of power surge that we saw, how do we think about resilience of this local food system in this kind of disruption? And what sort of data do we look to help us get a better understanding of what that means, what resilience needs to look like? So what I'm going to do, I want to just do a quick flyover of some of the feedback that we've got, some of the different data resources that we have, impacts that they may have for extension, and just land at the end here with some thoughts on where we need to be thinking about using these data, translating them into our relationships that we have in the local food system. Many of you are familiar with the Safe Graph program. A lot of folks have leaned in on some of that traffic data. One of the things that is very exciting in our kind of new world of data availability is being able to track people's movement and activity, and new data platforms have emerged that have really helped us to understand and look at things like this traffic. We could see very early in the pandemic, the pre-post surge in the supermarket activity, the plummet, the fall off the table, no pun intended, activity at the restaurant space, that led to just some big changes in how groceries responded, moving more to this online activity, restaurants substantially pivoting away from the fine dining and moving more into the delivery and online platform services, just following where the consumer traffic is. Some of you may know Alba Collard at Mississippi State. She's been tracking this kind of interesting social media, Google search activity for a lot of this local foods information that I've always found really interesting, and noting in the 2020 year, as the pandemic hits, the big disruption that takes place in a lot of these things. Interest in the cottage foods, the local foods, big surge, as you could see, in the online grocery, even the home gardening activity, where people are just changing the way they're thinking about food and looking to source their food, suggests that there are lots of new real-time data sources like this, where I think we have some opportunity to bring these kinds of data into the conversation to understand where we have real-time, very rapid changes taking place. We leaned a lot in this project on additional data and surveys that are being done by our communities of practice. The Farmers Market Coalition, for example, doing surveys of their farmers market managers across the country, and just being able to document the changes that were taking place in terms of the kinds of vendors that were being adversely or positively impacted, being able to confirm the non-food kinds of products that were being particularly adversely impacted. But another thing that they were picking up in the farmers market space particularly, that was very helpful to be able to have documented, were the significantly increased role that farmers markets were playing in SNAP sales, and the food security issues that were a lot of our local food system platforms were playing a critical role in helping to mitigate or try to be innovative around those kinds of spaces. In the farm to school space, again, just so many changes that were taking place, and the meal assistance initiatives that were being put together. Our National Farm to School Network themselves doing a lot of great survey work with the schools and collecting really good information about how schools were innovating during this COVID period to be able to pivot, help communities, help folks that had depended heavily on schools for food and nutrition, and adapting creatively during this COVID period. One of our kind of interesting partners in our collaboration was the local catch network that focuses on local fisheries and seafood sourcing. And Josh Stoll had just recently published this data set here, looking at, again, some of the data scraping, social media capture information on the surges that would take place in local food, CSA, seafood delivery, again, providing data information to producers and policymakers that were around the local fishery space to understand kind of the magnitude of impacts that were taking place. And both in terms of the surge and even some of the pullback that took place after an initial impact that took place. A lot of folks, initially were making kind of knee-jerk reactions to very anecdotal information, and being able to provide better, verifiable, independent data on what consumers were doing out there, hugely important to help us better understand and formulate policies going forward. Many of you folks may be involved in the niche meat spaces, and the meat market, as we saw from our very first presentation, lots of disruption that took place there. And again, through this national niche meat processors group, being able to document the growth that has taken place in the niche meat processing area across the country. And as USDA, the Ag Marketing Service particularly, is trying to put in place a pretty significant push in policy and support and financial new grant programs around this niche meat processing area, being able to document what's going on in terms of at the processors, consumer interest in these things is really important as we try to make good policy in a timely but thoughtful and well-documented strategy. Really challenging at times, I think, for economists here. Just in the certified kitchen space, thanks, Al. In the certified kitchen space, a lot of interest in folks moving into new value-added processing and the using certified kitchens, taking advantage of the local products to local markets. And I'm very familiar in Kentucky anyway. We have a lot of extension programming with our family consumer science agents and with our county extension offices that work in this certified kitchen space and helping folks in communities take advantage of these kinds of programs. And the increase in demand for technical assistance in these spaces and marketing assistance is continuing to expand. Even some aggregating things like food hubs and produce auctions, scrambling to manage through this COVID space. One of the things we've tried to do here at UK, working with our produce auctions, several hundred of them located along the Ohio River Valley states, from New York to Missouri, a lot of these auctions scrambling during this COVID period on how to adapt, and but also seeing huge increases in demand in these places and being able to track year over year sales from these auctions and being able to have this to be able to share into the public conversation, the national conversation about local aggregation of local products to local markets, gives us a good understanding of the role that these food hubs and auctions are playing in this aggregation role here. And so just finally, a couple of things to kind of pull us together. One of the things that we've really seen around the whole data space, and where there's going to be an enormous need for both research and extension, I think, moving forward, particularly as it relates to the local food space, are the challenges of distribution. And we've got this sort of distribution throw up of the apple cart and creating a whole new frame of new data needs, new kinds of analytics, new kinds of reporting and management that we're going to see in support of our local food systems, as our folks are constantly in the local food system developing new models, new analytics, and trying to understand how to manage those data to be better, more efficient, sustainable, viable going concerns, as we would say in our accounting jargon. And so, you know, as we moved into the food consumer survey, our national survey, as Haley and Jairus have already talked about, one of the things that we tried to do out of that was put together very quick, rapid response summaries that would go out to our extension community and our local food system community. Quick 2-page, easy to download, quick hitter summary things that could help folks get access to some of the timely results. I think a great opportunity for us as we think about continuing doing survey work, having strategies like this where we can get information out, even if it doesn't go to the full depth of analysis yet, being able to show things like the changes in online food shopping trends, and to help, whether it's USDA or producers or other agencies, see some of the changes that are taking place there fairly quickly, provides, I think, a real important service. We had a lot of folks that were using our resource hub, where we had these consumer food insights housed, and a lot of other resources there. I would encourage, if some of you folks aren't familiar with this site, encourage you to look and see what kinds of resources that our communities of practice and our research partners and our AMS folks were putting together to try to be a resource to our national local food community. So just the last slide here, the last thing I just wanted to say was, as we're turning the corner and thinking about changing roles for extension, I think there's an important partnership with agencies to create better data that's out there. And I think there's we see a need for continuing to improve national coordination, harmonization around data, especially in the local food space. Wearing an extension hat, you know, there's trying to understand the issues related to community and food, nutrition sources, costs, food preservation. As we think about policy and food access, I think that's something that we are certainly in the teeth of that now, but also just in terms of supporting the farm business models, these new business models coming with online buying, customizable CSA, the agritourism and experience economy. And just finally, just seeing so much need for cooperation and collaboration around both data collection and new business development, and communication about opportunities to pursue things on a very broad level, and being able to lean on good data sources, innovative data sources, and timely information, I think, is going to be really critical for us. So Zhao, I guess that brings us kind of to the end of our presentations. I guess I'll turn it back to you, and we can maybe look to Marilyn for some follow-up kind of discussion and lead us into our kind of bigger picture Q&A time for everybody.
Thank you, Jim. Is my audio still having issues?
Yeah, still kind of echoey.
Okay. I guess Marilyn can go ahead, and I'll try to restart my computer.
All right. All right. Very good.
Thank you.
Yeah, we've got an echo with you too, Marilyn.
Tim, can we take a 5-minute break?
Yeah, we can do that. Shall we take 5 minutes, catch your breath, get something to drink? We'll come back in 5 minutes and finish up our discussion and Q&A time.
Tim, I said my slides were really busy, but I'm going to show them anyway.
All good. There's still just a little bit of an echo from your audio for some reason.
I'm going to turn off my face. Are you still getting an echo? Can you hear me?
Yep, that works great.
Okay, great. I think it's because I was using two different ways of.
Okay.
So anyway, I'm ready to start whenever you guys are.
Is my sound working better now? You guys hear me?
Yes, thanks, Shal. Yes.
Great. So 10 to 15 minutes for this?
Yeah.
Okay. Great.
Yeah. All right, I'm going to go ahead and get started. Thank you, Tim and Becca, for inviting me to be a discussant for this most illuminating and important session. My slides are like really busy, so if you want to just close your eyes, that's fine. But I'm not going to go through this like really in detail, but just so that you know a little bit about my background. I've spent over 20 years as a public health epidemiologist. Starting in 2015, I started working on studies of that were funded by USDA on adaptations of the CSA model to try to improve access to local foods for rural consumers and also for low-income families, while also boosting opportunities for local producers to make a living, right? Currently, I am supporting development of a new food hub in southwestern Washington state and doing some market research for them. And so Tim asked me as a discussant to really reflect on how the information presented in this session would be most useful to farmers to capitalize on the changes in consumer eating and purchasing behaviors. And I want to be really upfront that my bias is that the more that we can advance local food systems, that will be very good for our farmers and also for our communities. It's a very resilient as well as potential for social justice in our communities. Now, I know we're all aware of what the situation was pre-COVID, but I think it's worthwhile to just kind of reflect a little bit on this. Pre-COVID, there was heavy dependence on grocery stores. Direct sales of local and regional foods was very tiny. And while direct sales were on the rise between 1997 and 2007, they began leveling off because markets were becoming saturated and competition was present from online sales and grocery stores. And in response, farmers were really experimenting quite a bit with various tweaks to existing models. They were, for example, for a CSA, they were offering payment plans, market style selection, cost offsets, and home delivery. And what I experienced in my research projects, but also from talking to other folks, is that in some cases, this really increased the farmer's burden. And the question was, is the juice worth the squeeze? Most farmers, in some cases, are not just business people. They're also social entrepreneurs. They have a concern about their community. They really care about equitable access to local food. So they're very motivated, but it did present a additional burden on them. And in addition, some people, low income, BIPOC, and rural, still felt left out of the local food movement because certain spaces were still being perceived as elite spaces. So what were the key impacts that stand out to me about COVID? Well, first of all, the fragility of the industrial food system became very apparent for the reasons that many of the presenters have touched upon in their presentations. Producers selling through direct market channels, however, were able to pretty quickly pivot and distribute foods slated for intermediated markets, as well as handle the increased demand for CSAs and institute curbside pickups at farmers market that made things safer. So it seemed that those supply channels were a little bit more nimble. Additionally, there were things like the Farmers to Family program that provided a way to make up for lost intermediated sales, that strengthened producer relationships with emergency food networks and helped to get more local food to people who previously were unwilling or unable to buy it. So in response, consumers were changing their food purchasing and consumption behaviors. And I think in this presentation or in this session, all the presenters have been focusing on, how consumers actually were changing their food purchasing and consumption behaviors through looking at what they were doing about eating at home and sourcing food, what behaviors were new and how persistent these changes were. And also in the last couple of presentations, talking about how this impacted values and how it was related to purchase behaviors. So I'm just going to touch very briefly on the things that really stood out to me in the 3 presentations that I was able to review ahead of time. I really appreciated Kristen's presentation that looked at a regional perspective on a shift in meals prepared at home, and that tried to quantify how much those 2 extra meals would translate to in consumer dollars spent on food at home nationally. I thought it was also interesting that there was this increase in fresh fruits and vegetable, which kind of complemented the finding about more people cooking from scratch. And that this was much higher than people who bought carry out or prepared foods at the store. And also the idea that people intended to maintain those changes in shopping meal behaviors. That was important. The finding from the next presenter, what stood out to me is that by the end of those 3 periods that were examined, people said they were buying more fresh fruit and vegetable and fresh meat, seafood, and eggs, which kinds of aligns with what others have said about increased meal preparation. Although, there was that finding that shoppers not buying from a CSA didn't change much over time, didn't go down, didn't decrease. Online orders for a CSA with at-home delivery was higher in the last 2 periods compared to the first period. Online ordering and curbside pickup increased in many venues during the first 2 periods. But obviously, at time 3, most shoppers were going back to on-site purchasing, in-store purchasing, or at the venue purchasing. I really like that choice experiment, and I'm going to spend more time thinking about it. But I really like that it showed that more than 50% of consumers were willing to pay more for local and regional foods during normal times. I think farmers are going to be interested in hearing that. I found Jairus's presentation really interesting. So for example, even though some of the values vary significantly by region and by location size, it's clear that affordability still is a key consideration. It's persistently a key consideration. But I did think that it was, and of course, safety protocols were really important. I did think it was really interesting to see that concern for convenience fell a little lower on the list, and that locally grown food, although it was about on par for convenience, it still was a little bit more than, slightly more than the moderately important for all location sizes. Endorsement for what I consider altruistic values were important. Doing one's part to avoid COVID spread rated the highest across all of the regions and location sizes. But concern for local economies, human and animal welfare were above the moderately important level. People seem to believe that their choices could make an impact. And even though urban areas rate some values higher than other locations, they're still persistent across the board. I thought it was interesting to note that local food isn't perceived as accessible in small communities. The question there was, maybe this is because producers are moving product to larger markets. And I kind of am holding on to that thought because I do have a very strong interest in rural communities. So now getting on to what I think about how these findings might help farmers or what would be of interest to farmers. Well, first of all, I think that COVID gave people an experience, an excuse, a push, a no alternative but to try to shop and prepare meals at home differently. It was unusual circumstances. So it gave people an opportunity to do something that maybe they wouldn't have tried on their own. And we did see in the presentations in this session that people did prepare more meals at home, and that led to them having a higher demand for fresh and frozen fruits and vegetables. And if this is sustained, this could be a very positive thing for all farmers, but particularly for local and regional farms. I noted the frozen fruit and vegetable increase as well, because as Tim had pointed out, focusing on infrastructure is a very important concern for local food systems, and many are focusing on investing in processing infrastructure for both meats and fruits and vegetables, and freezing that allows people to offer these things at farmers market or for online purchases. Secondly, I think the experience with online ordering, whether it is for a local market or for an online marketplace like Amazon Fresh, or even a meal kit, helps to reduce consumer hesitancy in using these methods. We did our own little consumer era survey for the 5-county region that our food hub serves. And what we heard from many of the older customers is, no, I wouldn't want to try to buy local food online. Yes, I want to see it. And I feel confused about technology. But doing this and trying it during a COVID period might help to reduce some of those barriers and make it easier for people to switch that behavior from shopping from a faceless grocery store online to someone they really know in their own community. It seems like some changes are sticking. So for example, the presentation that Haley gave, there was one slide I was able to preview before about how the farmers market, new shoppers at farmers markets and CSAs was about 3% each in April 2020, and over 30% were still shopping at those venues 5 months later. I think that that's a really promising and interesting finding. I got excited about that. And of course, that translates to a lot of people nationwide, 3% of the population. Many local and regional farmers know what their customers want, but knowing what non-customers want is equally important. Jairus showed that during this uncertain pandemic period, affordability was really important, particularly outside of large urban areas. But even though the importance of convenience and local foods was lower, and once again, I think that the fact that local food isn't perceived as accessible in small communities might provide an opportunity for outreach. So, from my perspective, COVID led to a heightened awareness of the weaknesses in the mainstream food system, and it gave people an excuse, a chance in response to eat more meals at home, to prepare more meals at home, change what they eat and how they prepare it. People shopped at new venues and in new ways. Some tried local food venues for the first time, and some still shop there. So among those who did try a direct venue for the first time or shop there more frequently, I think the further research needs might include looking long-term, what changes and attitudes persist, and to what degree did the new experiences with these venues shift values and lessen barriers to participation. So for example, did feeling more secure about food safety and reliability of the food source associated with local food outweigh convenience or price? Exploring that a little bit more. And also questioning whether feeling confident in placing an online order and being habituated to curbside pickup helps reduce some of the objections that some people have to purchasing a CSA or going to a farmer's market. Does it make it easier? For those who don't shop via a direct-to-consumer venue, I really want to emphasize what Jairus said about delineating consumer segments and looking at how certain value clusters are associated with market behavior. To find out more about what COVID research can teach us about encouraging the non-DTC people to start buying local and regional foods. I think in association with all of the marvelous research that has been presented in this session, but also follow-up research that might be done, it all kind of boils down to what is the best outreach method. If we understand how consumers, if we understand the segmentation of consumers, which might very well differ in different population sizes. It might be very different in the big city compared to a smaller town compared to a rural area. There's still this question of what is the best way to attract and interest people. As a recent paper concerning outreach in rural communities noted, marketing that appeals to those that espouse these altruistic values or values associated with alternative food networks might actually alienate other segments if that segment perceives local food to be an elite space or something that is fancy or that is expensive. There are all kinds of myths about local food that are negative that might keep some people away. Crafting experiences. So anyway, Kim Kiss and Ackerman suggest that crafting experiences that bring farmers, local food, and non-DTC people together can help to begin to build successful relationships between farmer and consumer. And this isn't necessarily what happens at a farmer's market or at a agro-tourism event. It's something that happens in the spaces where these non-DTC people feel comfortable and where they tend to congregate, such as at a church space or a school space or even a health clinic space. So finding ways of meeting people where they are, I think is an area that would be ripe for more exploration and experimentation. And this is a way, I think, to combine an experiential kind of learning with a more traditional educational approaches. People are not rational and don't always respond just to information. So finding other ways to get people to open up and explore, I think, is really important. So I'd like to see more exploration of that kind of approach with rigorous evaluation. I also want to underscore a related idea, which is that there are many, many people who have never gone to a farmer's market or never purchased a CSA who got a Farmers to Families box during COVID. They didn't have to pay for it. They just got it because they were people in need. And so the question is, how can we, these are people who've had an experience with perhaps a local farm. In our Washington area, our little baby food hub actually was able to participate in this program, and it was a big source of revenue during their first pilot year. And now our question is, how are we going to turn those folks into customers? They've already had a beautiful and very positive experience with local food. They like the fresh, wonderful food that they're getting. How can we make it easier for folks who are still maybe struggling with unemployment or maybe have been low income to make local food more accessible to them? One of the things I kind of missed in the presentations today, and I think that Tim alluded to this, is that during the COVID period, there were many alternative ways for people to get food. It wasn't just through trying a different consumer venue. People were gardening, they were bartering, they were accessing the emergency food system. In my local community, there were mutual aid societies just comprised of ordinary citizens that were setting up food is free tables where people would just bring things from their garden or other sources or donate food, and people could just come and get whatever they wanted. So that's part of the local food system too. And I would like to see a little bit more thoughtful research on how a more holistic local food system evolved and emerged and gave people new experiences during COVID. So anyway, those are my comments, and thank you for listening.
Thank you, Marilyn. So I guess now we can have a question and answer session. If anyone has any questions or about any of the presentations or what was discussed here, they would like to raise. I guess I have kind of a question. Maybe it's more of a comment than question. I know a lot of the presentations here have really talked about the survey data they've used to explore these research ideas and consumers and local producers during COVID. Has anyone really thought about using more reveal preference, such as scanner data? Because ERS has heavily invested in scanner data to kind of explore these issues, especially during COVID, and we're getting more of that. So has anyone thought about that as a complementary piece to these surveys? Because these data have unique pros and cons that can potentially explore things that are different.
Well, this is Dawn, and that's a good question for you. We have colleagues here at CSU that work with scanner data, and I know there's 3 different versions out there, and it's which ones too, but tell me if you feel like there's actually enough detail in those scanner data to actually disentangle what we would call local and regional markets, because that's never been very clear to me, and I know it's changing across time. Yes,
that's a very good question. So right now, so I'm a little bit more familiar with the IRI data that we have at ERS. As right now, we're getting so we have something that's known as the real-time data, which is more aggregate levels. So to get any kind of findings of regional or local food systems is kind of harder. But I don't know if a lot of you have worked with the traditional IRI data, which is very detailed. It has like store level sales data, individual product level UPCs, and there's also a consumer panel where it has household demographics and lists what exactly they purchase. The 2020 version of that is coming online soon. So that I think would be able to try to, if you were looking at how consumers are shopping at local and regional food systems, you could potentially tease out some of that local products. It's still a little bit harder because it's really hard to identify what products are local, especially in produce and meats, but there could be ways to kind of get at that potentially. Maybe you guys are a lot smarter than me, so maybe you can figure a way to do that with using that scanner data. So, but I think there is definitely potential ways to do that, so.
Which branch are you in again, John?
I'm in the food markets branch.
Yeah, maybe we should talk.
Yes, that'd be great.
Yeah, I think I agree with trying to identify in scan data what actually is local and regional. As of a number of years ago, we had an Apple category buyer explain to us how at this retailer, nothing is actually labeled as local. And so they can only infer local sales because it occurred during the harvest season, and they happen to know that if it was, in this type of package, then it was most likely local. So but otherwise they did not have any identifier or UPC. So I don't know if that's changed.
Yeah, for the produce and meat, it's a little bit harder because it's a little bit more aggregate categories. I think they're getting more detailed. So I know for one of my dissertation papers, we were looking at more processed foods where you can actually identify the local manufacturer. So we were looking at ice cream specifically, but that way you can actually identify because you can identify what the actual product is, you can identify where it's being manufactured. So that is sort of one way for more processed foods where you can identify local foods. And what consumers and get the valuation there. But for more produce and meats, that might be a little bit harder, the way the current data is structured. So
on the produce, I've been kind of impressed with what can be done with that IRI data. Some of the sessions that I've been in with the Produce Marketing Association, they've used some of that data to pull out just what's going on. Again, it's more aggregate. They're not talking so much about local, but frankly, in our world here in the university and specialty crops, we haven't looked at the aggregate very closely. And a lot of times we tend to pull our own survey data, and that's useful, but looking at what's going on across the whole sector, I've gotten some really, I think, decent insights from hanging out with those guys a little bit more.
Yeah, it's definitely it's very good data for looking even at like apple, like going just the produce, like the different varieties or more specific stuff. So yeah, it's very helpful, and very useful for research. So did you have a question, Tim? Your hand is raised.
No, I just had a follow up. You asked if anybody had a question, so I did. I agree with everybody else that this kind of very limited role, I think, for the Nielsen IRI stuff, just because it is so exclusively grocery oriented, and the local food system space covers such a wider platform of markets. And as I said in my comment before, I think something that's just sort of inherent in the local food system space is this kind of gray market of data that is not very well developed. We don't have really good time series, cross-sectional, but I think looking forward, I think there are some innovations that are developing out there with, especially as the local food system community is starting to move more into online delivery. That's not perfect. It leaves a lot of people out for sure. But we've seen some kind of innovative things that have been done with web scraping and other kinds of tools that can track activity, changes in activity that are taking place on various websites in an aggregated kind of a way that I think provides, some interesting promise for the future in terms of just evaluating structural changes, broad changes nationally, regional, urban versus rural, different kinds of commodities, the local produce versus local meat and dairy products. I think there's a ton of potential out there in that space.
Yeah, and going along.
My initial question, though, before the IRI question, is really just, and we ran into this problem with our national consumer survey with our AMS project. Everybody here did an online consumer survey, and are we missing important demographics of people that might not be represented in an online survey in terms of COVID impacts? I just wonder. I think there's at least maybe a tendency. I know we tried to stratify. I think some of you other guys tried to stratify as well to accommodate some urban, rural, but it still assumes everybody is online. Be interested in thoughts for you guys, that other folks that have been involved in the survey design stuff. Pros and cons. We did the same thing, but interested in other people's reaction.
I actually, there have kind of always been problems with getting to consumers, even when it was telephone interviews. People had to have a telephone and you had to be able to reach them, and it was a real problem getting a good sample with telephone interviews, or even mailing to addresses. Do the people have adequate reading skills to answer a written survey that went out to them to a mailing address? So I think there have always been some limitations in trying to reach everybody. And that's certainly true. And, you know, I actually am one that do not have a smartphone. So, but I think that there's a tremendous percentage of people who do have a smartphone and I think that helps. That helps. They might not be online like we are online, but having that smartphone, I think, really does help with the online consumer surveys, although I think you're right that it is probably biased.
Just to follow up on what Chris says, yeah, the penetration for smartphone usage in some of the communities that we are missing is pretty high, but that in our case, all of us used Qualtrics panels, or a bunch of us used Qualtrics panels, and there just may not be enough recruitment of those populations into that space. The accessibility is there, but they're not being asked in the same way that other communities are being asked.
Yeah, I think it's important that we just understand who we actually have in our sample. And I've asked that question a lot of times. Tim, you know, if I go back, and my memory is notoriously bad, but didn't that one paper that we did with Wu Yang and some others, didn't we look at whether there were major differences between online versus other forms of surveying, and that had to do with willingness to pay, but I don't recall that there was that much of a difference, and that, as I remember, surprised some of us. Your memory.
Yeah, you're right, Stan, and that was, I think, papers like that and some others, I think, it's so efficient to be able to collect these data online, especially if you're able to stratify your population, even oversample certain segments where you might have some concern. And we did it. I think the way to mitigate some of that is collecting larger numbers of observations and really trying to drill down in segments maybe where you feel are underrepresented. But let me just point out, Jairus and I did on another consumer study. It's a local food vitality index study that looks at consumer perceptions within a particular community. And in the community of Baton Rouge, Louisiana, we did an online survey and got the results and saw things sort of mapped out one way, and talked to some folks there in the city. And they said, well, we're really not getting any representation from this key ethnic part of our population that is just completely underrepresented here. They agreed through a couple of faith-based places to do some paper, handout, survey, read, collect in person. It was like a whole different city, just looking at the results between those two different communities. And it just gave me a little bit of pause as a researcher of just being too quick maybe to over rely on thinking that we've got an accurate view of some important segments, especially for things that are as critical as like food access or yeah, I'll just leave it at that as a.
Well, you just made my point there, Tim. I mean, we need, as researchers, and I really don't get a chance to do that anymore, but as researchers, we need to be paying really close attention and being maybe even counting on some friends who have nothing at stake and are more obnoxious to say, hey, wait a minute, you know, what do we know about the population for real where you're going to be talking, and have you actually reached them? Because there are those instances out there where we do miss. It may be low income, it may be rural, it may be whatever it may be. It might be Amish that we're not going to get our sample the way it needs to be. But you know, as researchers, we've got to do a better job, I believe, still at critically beating ourselves up, not just trying to grab data.
Tim and Stan, I just wanted to make a comment that I'm a big believer in mixed methods approaches. So I think that quantitative data is great. I love it. That's the basis of my training. But I've also found that qualitative data is equally rich and sheds additional light on a subject. So I think oftentimes that's a little bit easier way to get at these hard to reach populations.
Absolutely. I don't know, I'm missing who you are, but
Marilyn.
oh, they're Maryland, woman after my own heart here, because and Tim, I think, pointed out, or it was either Tim or somebody pointed out that they had used qualitative stories to help set the stage for even some of the quantitative work then that they were doing. And that's a really strong point.
Yeah, Stan, we definitely, in the project Tim's talking about, benefited from the fact that we had these 16 listening sessions with our industry groups, and some of those were from underrepresented farm populations even, that certainly helped us get some insights. I guess you just made me realize, though, it still doesn't get to the heart of if we didn't get people to respond to the survey at all yet. We did build in some checks so that we could see if our expenditure data lined up with BLS expenditure data. And we definitely checked that at the median income level. But I didn't think about it till now, but we could go back and see if our weekly expenditures line up with even the lower two income quartiles, since that, I think we're all talking about that being the share of the population we're most likely to have not hit the mark on. And we didn't think of, I did not think of going back and doing that, but we have the data, we could do that. So that at least would get a little more insight about whether our results line up regardless of people's income level, which is one measure at least.
One thing I liked on a number of the presentations today was the fact that y'all did point out where there were potential problems and traps. And I don't think folks around this group tend to be a little more oriented that way and be willing to say, hey, wait a minute, I might have a real problem here because we didn't get this certain sample. But I don't know that overall as a profession, we do a good enough job of that. And I'd encourage you all to continue, even in those more academic presentations, to emphasize where there are some real problems, or potential problems, I should say.
I had a question about the access to local foods in the smaller communities, or the lack of, I guess. Do folks think that that is a supply issue, a demand issue, a perception issue? As Marilyn mentioned, some of those communities respond poorly to certain kinds of outreach around that, or is it that the smaller independent supermarkets or the super centers are less likely to stock and promote a local producer?
I mean, I can answer my experience, since I think I sort of was the reason this got brought up. But I think part of it is a perceptual thing in terms of, there's local food in rural communities. It's just it might be called something different. It might be called like farm fresh or homegrown, or there might, like Marilyn had mentioned, there's certain vernacular that might have a negative connotation associated with larger markets and, other things like that. So when you give a survey that talks about local foods, that's not going to resonate necessarily with people. But then there's also, at least in Eastern Kentucky, we had done this project looking at sort of the feasibility of doing, getting local food into grocery stores and things like that. And part of the problem was most of the grocery stores, supply chains, they relied on, accessing larger, more regional and national supply chains. And anytime a farmer would try to get their stuff into like a Save-A-Lot or, whatever it might be, they're gonna, run into problems from the distribution center saying, no, you gotta either go through us or, which then is a scale problem because there's not enough product to then fulfill the needs of the distribution center. And so, if that's your only option, if the Save-A-Lot's your only option, you're going to be relying on things like roadside stands and people in July bringing zucchini to your door and dropping it off, and not regardless of whether you want it or not. So local food, it just has a completely different manifestation, at least in our experience.
Of course, if you fix the pull part of the equation, I guarantee you the retailers will figure out how to fix that. So if you to create the demand, they will be fulfilled. That's for sure.
Yeah, I agree. I think that that's the key is unlocking interest among people who are not currently buyers. What Jairus was saying before about getting food into local markets in small rural areas. We created Farm Fresh Food Box program in order to respond to the going out of business for many of these small grocers and retailers, and trying to revitalize those enterprises within small towns, so that a CSA type food box could be sold through ordering at a convenience store or a small grocery store without a long-term commitment. That model was really successful, but sometimes we sold it in, and we did this in 3 different states, but sometimes we sold it in gas stations and convenience stores. And farmers kept asking, how are we going to reach the people who shop there? They go in there buying their cigarettes and their beer on a Friday night. They're not expecting to buy fresh produce. So what is it going to take to get those people to get interested? I still think that that's an important question, because right now, a lot of people are driving out of their communities and going to big superstores in order to get their produce. And many of those big supercenters do sell what they call organic or local. I'm not sure exactly whether that is a true label, but I would rather see people buying food in their own communities that comes from their communities.
I found very interesting, Marilyn, when you called the value that consumers give to local produce, you called an altruistic value. And I thought that was spot on, because what I see in my research is that local produce is still considered a luxury, because the local producers cannot compete in price with the mass merchandisers and supermarkets, for that matter.
I agree, and I think that's a part of the impetus for farmers, local farmers, turning away a little bit from direct to consumer to intermediated markets, so that they can make up in volume what they have to sacrifice in price a little bit. They do have to be price conscious to sell to schools and to bigger institutions, but they make up for it in volume, particularly a food hub. Which is a great part about that model. But some of the food hubs we did case studies on in Washington during the pandemic found that this farms to family box really saved them. And through that experience, at least one of the food hubs said, when we look at the numbers and we look at our balance sheets, it really makes more sense for us to go back to a CSA model rather than try to go to an intermediate market. So I think there's lessons to be learned on the producer side too, the small producer side, in terms of lessons learned during the pandemic.
Mm-hmm.
I guess I also want to say that I was really interested in the large national study with 5,000, the Colorado State study, to find that many people held those values, even if they didn't say it was the most important thing, and that they had a lot of, I know you didn't call it self-efficacy, but that they felt, I can make a difference in my community. I can make a difference to my local economy. These weren't just people who are shopping for local food. And maybe the reason that interest or importance of local food wasn't as high as safety or something like that, is because people aren't connecting. Local food does allow me to support the local economy. It does allow me to have nutrition for better health. But I think that was kind of an exciting and intriguing finding from that study.
Yeah, and you probably don't need to correct. Self-efficacy is a good word. We just are trying to stay with the psychologist literature's concept of perceived consumer effectiveness, because it actually kind of aligned with something Becca on the team wanted to do, which was about consumer confidence, but we just didn't do it all in money terms. We did it in value terms. But what was surprising, and I think Kaylee highlighted this, is by far and away the biggest concern was about people playing their part in mitigating the impacts of COVID, which in this day and age, again, because we're now seeing the resurgence, is hitting home really significantly, because it feels like we're just going to go through this all again. But that I think gave the most heartburn to our communities of practice, because if that is really the guiding beacon, that's temporary. So I think there was some concern about, if it be temporary, the only silver lining in how long this event has lasted, which I think for all of us, we can't believe we're still really having our lives affected as much as they are, is that, most habit formation literature out there says after this long of an event, now some things that are being done in theory temporarily become permanent. So we are struggling a bit with the team, although, these concerns about surveying give me pause again, whether to put out a follow-up survey with approximately the same questions just to see what we do find. Just because it has lasted longer, at least I perceived it would, particularly if there's this resurgence. So that's the most curious thing to us, is like, how long does something becoming a new value or priority need to be there before you permanently change the way you approach some key parts of life, including food shopping. So I think there's going to be research to do for many, many years on where food spending ends up at the end of this.
Yeah, no, I think this has all been just a really, really interesting conversation. I'm so glad we merged these sessions, because there's just such richness here. And, I've been thinking a lot about, I don't know if anyone's looked at the No Farm to School census results just came out. To me, one of the most interesting things in the new farm to school census is that if you look at the people in the most recent farm to school census, not the one that just came out, but the one right before that, who said that they were going to start a new activity, only a third of the respondents who said they were going to start a new activity actually did it. And so, thinking about these questions about it doesn't get exactly what Dawn's saying about this change in behavior, because I think that's a different piece, right? But in thinking about ability to respond to these surveys, sort of predicting how you're going to respond in the future, even if you have certain types of intentions, right? I think that's a pretty good indicator that we don't actually follow through on the things in the way we think we're going to, right? And those questions aren't really that useful.
Becca, I follow through on everything I do all the time, so I don't know what you're talking about.
I know, that's why I love working with you.
I was actually joking.
Well, does anyone else have any other questions or thoughts or comments? If not, this was very enlightening. Thank you for all the presenters. Thank you for Marilyn for being the discussant, and especially thanks to Tim and Becca for organizing this. I know I learned a lot, so hopefully everyone else did too. So hopefully I can be part of this in the future as well. And it was great seeing everyone. So
cool. Hey, I had a question for Tim and for Becca. Will there be circulation of slides to the folks who attended the session?
Yeah, I dropped a note in the chat there. We can.
Great.
I don't mind making mine available. The session was recorded by AAEA. I've got to figure out where that winds up being housed. But it might be easiest to maybe reach out to specific individuals that presented if you wanted to get their slides directly to be a little bit more efficient. And I know for a lot of the folks, it's kind of ongoing work and things are being constantly updated. So there may be subsequent versions or additional information that they've got available that would be really worthwhile. And so I know for my part, I've got several things I'd like to follow up on, but maybe that's the easiest way to pursue there. Yes, thanks, Sal, so much for facilitating, helping us navigate all the technology stuff, and everybody for participating here on a Friday afternoon. And hopefully we can all kind of keep connected as we're all working forward in this space.
Yep. Have a good afternoon, everyone.
All right. Thanks all.
Thank you. Bye-bye.
See y'all.